Hi, my name's Amber Hodge. I'm a student at Maryville University. I've had several problems trying to create my head-to-toe assessment for a health assessment class for grad school. So my only option, since my video is stuck in VoiceThread and it is not uploading, is I'm simply going to basically record a video of it playing on my iPad since it is stuck in my iPad at this time. So I'm going to go ahead and play my video now. And thank you very much. Hi, my name is Amber Hodge. I'm a family nurse practitioner student at Maryville University. Today we're going to be doing a head-to-toe assessment on Mr. Johnson, who has already given us consent to do so. I apologize, this recording was already done earlier this week at a primary care setting office, but for some reason the video didn't get uploaded, so we are redoing it at home, and we're going to make necessary modifications to basically just verbally explain everything that we're missing, instruments, appropriate instruments to get this exam done. So, Mr. Johnson, if it's okay with you, we're going to go ahead and get started. So actually just 2 days ago he was at the office. We examined his vital signs. They did great. He was 108 over 68 for his blood pressure. He was 69 heart rate, no temperature, 97.2, 98% oxygen. He weighed 157 pounds and was 6 feet tall. And so we're going to go ahead and get started. Mr. Johnson's already been asked to empty his bladder, so he's done that. And we're going to start off by just overall generally inspecting his head and his face, looking at his overall appearance, how he's dressed, his hygiene, um, so basically we're going to start off by asking him to just look straight ahead at us. And we're going to start with part of our neuro exam, which throughout the course of this assessment we'll be testing all different nerves. So basically we're going to ask him to start by testing cranial nerve 5 and 6 by clenching his teeth. And you can smile for me. I'm going to ask you to open your eyes wide open and wrinkle your forehead. So you can go ahead and begin by clenching your teeth for me and smiling. And stick out your tongue and puff your cheeks for me and wrinkle your forehead. Perfect. And then now we're going to go ahead and just begin by, obviously we're already inspecting his eyes, the symmetry, looking at his sclera and conjunctiva, but we're going to go ahead and do a partial eye exam. Like I said, since I don't have enough ophthalmoscope or an otoscope, I'm just going to verbalize what I'm going to be doing. So at this point, we can basically simultaneously palpate the sinuses, his frontal sinuses, his maxillary sinuses, and ask for any tenderness. Does that hurt at all? Okay. And then we're going to go ahead and just palpate his ears, his auricles, and we can go ahead and test his lymph nodes now, looking for any nodules, any swelling in his lymph nodes, and just note the characteristics, the size, and where those are located. So you're going to go do your preauricular right in front of the ear, your postauricular, your submandibular, your tonsillar, submental, and then you can move on down to do your superficial clavicular chain, and then you're going to move on down here to do your supraclavicular. Now, if you were to feel a supraclavicular lymph node harden, you would definitely want to go ahead and follow up on that. That's highly indicative of there's some type of cancerous process. It could be linked with the abdomen. So that definitely would be a clinical sign to look further into. So moving back up to the eyes, like I said, we're already inspecting them, looking for any drainage, any eye drooping, eye dryness, anything like that. If we had an ophthalmoscope, we would go ahead and use that to visualize his retina. But we don't, so I'm just going to use a pen light here to better assist us looking at the sclera and conjunctiva, and you're just going to pull his eyelid down. And basically looking at his sclera and conjunctiva, like I said, for any drainage, any eye redness, especially this time of the year. A lot of people have allergies, which he did not, so that was really good. At this time, we could also look at both of his pupils and look for his pupil reflex. And basically, at this point, everything looks good. So I'm going to go ahead and have him move on to assess his visual acuity test, which we can do a near vision screening. I have a Snellen chart downloaded on my phone, which you would ask the patient to look basically 4 feet away from the patient, and you would ask him to read the furthest line down. So if you can do that, sir, go ahead and read me the furthest line down that you can see clearly.
EPCCELEC.
Perfect. And that puts him at a 20/20 vision, which is great. And now we can go ahead and basically assess, so his near vision screening that assesses his visual acuity, which also measures cranial nerve 2, which is his optic nerve. So cranial nerves will be assessed just periodically throughout this exam instead of all done at once. So basically at this point, now we can go ahead and do the cover-uncover test with his eyes. And basically looking directly at the patient, you're going to ask him to cover one eye. So if you would do that for me. And I'm going to cover my eye directly across from his so that our open eyes are directly looking at each other. And you're basically just going to test his peripheral vision at this point, starting by extending your arm and bringing it more centrally. And basically just noting when each of you see your fingers in the peripheral vision and comparing if it's a delayed response to comparing when you can see it. And you'll test all 4 visual fields. So we'll go ahead and do that. And so just let me know whenever you can see my fingers in your peripheral vision, okay? And looking straight ahead of me only, keep your eyes directly at me. And we're going to bring them in until you see my fingers. Okay? Perfect. Perfect. And then if you can go ahead and switch eyes for me, and we're going to compare the other eye. And you're going to repeat those same steps here. So you're going to start with your arm extended, bringing your fingers centrally, and let me know when you can see them, okay? And let me know. Okay? Perfect. Okay. And then now you're going to keep looking straight at me. If you uncover your eye, please. Look straight ahead at me. You're going to look just at my finger only. Do not move your head, eyes only, and just follow my finger for me. So you're going to move once again in all four directions. This is to assess your extraocular movement, which also will assess your cranial nerves 3, 4, and 5. So basically, you're going to look straight ahead at me and just let me know if, that you can see it. So follow my finger for me. Perfect. Oh, we're going to go up and to the right, down and to the right, across. Perfect. And perfect. And look at my finger and bring it directly to the patient's nose. And then you would want to ask them and see if they've seen any double vision at that point. Which, did you see any double vision?
Nope.
All right, perfect. And at this point, we would move on to an ear exam. Since this exam is being redone at home, I do not have an otoscope. But at this point, basically, you would want to take the otoscope and you would pull the pinnae down and backwards to straighten the ear canal. You would insert your otoscope about 3/4 of an inch. That should not cause the patient any discomfort, but you might want to warn them that it may. And so then basically you would just tilt the patient's head towards the opposite shoulder, and you would insert the otoscope, and you would basically just assess the tympanic membrane, making sure that it's a nice pearly gray, and also assessing for the earwax, impaction, any drainage, any foreign bodies in the ear canal, and basically that would conclude an ear exam, and then you would just compare it side to side to make sure that there were no differences in any redness or anything like that. as well as, like I said before, you would want to give the ear a little tug to make sure that could help indicate if they had any irritation or any possible ear infection going on. So that would conclude the basic ear assessment. Then you would still use that same scope and you could tilt the patient's head backward a little bit. You would insert the scope into each nair and basically visualize the nasal canal for. Alrighty, this is a continuing on of the health assessment on Mr. Johnson. We're going to pick up where we left off with verbalizing what we would do to assess his nasal canal. And basically, like I said, we would continue assessing for any drainage. We would assess basically the septums for size differences, symmetry, any extra skin growth, redness, drainage, anything like that. So that would basically conclude our nose exam, and then we would also ask the patient at this time to open up their mouth for me, and then you could take a tongue blade, which I do not have. You would depress the tongue. You can ask them to say ah, and basically you would assess the gag reflex. More importantly, Mr. Johnson is not a smoker, which is great, but if he was, you would want to take the tongue blade and assess the sides of the tongue, the cheek, underneath the tongue, and the back of the throat, particularly for smokers, because that's a high rate of places to see signs of cells changing, and that you could pick up that on early signs of cancer, and once again in smokers, but Mr. Johnson is not a smoker. So simultaneously at this time, you would be looking at his lips and skin, like I mentioned earlier, his mucosal membrane, and basically just assessing for signs of dehydration to see if they have any diagnosis or anything that would give us a clue that we need to further evaluate for signs of dehydration or possibly some cyanosis or something like that going on. So basically at this point you would already have noted his dental hygiene while you were assessing his mouth, and you would want to just take note of that. So that basically moves us on to the neck assessment, and at this point still looking at the patient directly hands-on. We already assessed the lymph node, but you could go ahead and assess directly on. You would want to just note his thyroid placement and make sure it's nice and midline, it's not deviated, and if there's any extra nodules or anything like that. So at this point, still staying on the neck, you could go ahead and assess his carotid arteries. You could ask him to turn his head just to the side a little bit, palpate his carotid arteries, and at the same time, you could be feeling his radial artery, just to make sure that you're just kind of noting his carotid artery and his cardiac cycle, and then you can compare it to his radial pulse, which is most generally where we take the pulse from an assessment of heart rate. So those seem all symmetrical, which is good. And we're going to go ahead and move on and ask Mr. Johnson to take off his shirt, please, if you wouldn't mind doing that right now. Perfect. So once again, we're just noting any, at this point, ideally you would want the patient laying back at a 45-degree angle to adjust for, to assess for any jugular vein distension. But you could also just make note of it if it seemed like it was distended at this point. You would want to look further into that. Also, just now that his shirt is off, you would want to continue assessing skin and just noting his skin characteristics, including his color, any modeling, any abnormal lesions or skin growth. And now that you can visualize the abdomen, you would also want to look at his abdominal muscles, his spleen, his respiratory status. Now we can visualize the lungs, looking at the chest and seeing if there's any abnormal growth, including like if they were to have a barrel chest, you would be able to see all of that at this point. So now we're going to go ahead and move on to, we'll come back to when the neck, we'll do passive range of motion with the neck when we later on do the musculoskeletal system. So at this point, we're going to go ahead and, like I said, we already palpated the carotid arteries, and we noted the tracheal position, his thyroid positioning, and now we already asked the patient, well, at this point, you could also ask the patient to swallow, and you would want to go ahead and do that. Swallow for me. Thank you. And then at that time, you can note also any tracheal displacement, and at the same time, that will assess the cranial nerve that for his swallowing. So at this point, if you noted his thyroid was enlarged at all, you would want to assess for a bruit, but his is not enlarged, so that is not necessary for this exam. Moving on to his upper extremities, now we can visualize his nail bed, also noting for any clubbing of his fingernails, and if his nail beds, assume if there's any pillar present, any edema present. You can also feel his hands to notice what his temperature is, noting his hair characteristics on his hands, also noting furthermore if his skin is dry, if he has any skin issues on his hands, including just basically particularly noting if there's any diagnosis going on with the fingers that you would want to look further into for his respiratory status. So everything at this point looks good. We've already assessed his radial pulse. His brachial pulse we could also assess at this time since we have good access to that, which feels nice. And you can once again compare the radial and the brachial just to assess the cardiac cycle and make sure they're in sync together, which they are. So at this point, I'm going to have Mr. Johnson turn and face his left side, and I'm going to move this camera so we can just get a further view here of his chest and lungs. And so I can do that exam here now. All right, perfect. So once again, we're just looking at his general skin inspection, noting if there's any thoracic abnormalities in the diameter of his chest. And we're going to move on to his chest and his lung assessment. So basically at this point now, you can go ahead and begin really with auscultating the lungs or with palpation. It doesn't really make a difference at this point. But for the sake of this exam, we're going to go ahead and inspect his general inspiration. So we're going to go ahead and ask him to take a deep breath. Go ahead and do that for me. And at this point, you have your hands at his 10th rib, which is basically just assessing his expansion of his ribs and all that with inspiration. So at the same time, you can be feeling for tactile primitives. Once again, take a deep breath. And exhale. Perfect. And at that point, you would be feeling, you could just basically feel for abnormalities with that. Also, you could have him say, do an inspiration one more time. And you're going to say 99. 99. Perfect. And that basically will help indicate if there's any consolidation in the lower lungs. And so basically at this point, we can go ahead and percuss his lungs, his base of his lungs, and we can actually go ahead and palpate and percuss his kidneys since we're looking at the back now. So at this point, we're going to go ahead and ask him if he feels any tenderness right here when you're pushing in. Does that hurt at all? And that would be basically his kidney area. Once again, you can go ahead and locate that kidney area with your palm down, and you can basically use your opposite fist to beat on your hand here, and you can assess for dullness and asking once again, it should not inflict any pain on the patient when you are percussing his kidney area. If it does, you would want to look further into some type of kidney infection or something like that. So at this point, we're going to go ahead and move on to basically listening to the back of his lungs since we have him positioned this way. And basically listening for in all five of his lobes. You would want to just basically assess his intensity, his breath sounds, his quality of breath sounds, any extra sounds in his lungs that you would not want to hear, like such as crackles, wheezes, any rhonchi, anything like that. You would basically assess for. And at this point, we're already generalized. We have a generalized assessment of him, noting if his, if he's